The partnership between SOS and El Sol is to establish better care for the families here at El Sol that are uninsured and have low funding for medical assistance. So we are helping most parents to link them to medical services and other social needs that they might need.
Where I feel really excited to be able to be at El Sol is instead of waiting for those people to drive down the 55 freeway to us, we're able to meet people where they're at, and we're expanding into a community that we were already serving, and by going to that population, that's really meeting a true need.
A lot of the patients have never, families especially here from El Sol, have never ever gone to do a physical exam, have never gotten any medical care because of their beliefs, the part of the education where they think that they're going to probably see or find something bad, and so they don't want to know. But because we kind of sold this program to them, telling them that it's, if you get healthier, your kid's going to be good, and then obviously it's going to be a great connection for their education. They're doing it more for their kids than themselves. So right now we've helped a lot of the families to stay healthier and obviously to take care of their health in many different ways.
It's somewhere where they can go to if they're worried for their health. Many of them have no money, no type of insurance. They can't go anywhere else, so this is their go-to place. And they need to stay healthy for their kids, so they take the initiative to come here and get checked.
And what do you think?
Huge to be part of SOS. I think it has, not only as a parent from the school, because now I have my kid here, but as whole, it's a connection, it's a bridge that a lot of people can't get to, or a lot of the people from the community can't even get linked to a lot of the services. Once you are part of SOS, you are able to give them that hand, hold them by the hand and tell them it's okay. At least there's a light at the end of the tunnel for a lot of these families to know that they're going to be taken care of.
And again, I think the tenets and the roots of SOS are absolutely there, but again, it's a different expression within that community, working with Latino Health Access and integrating the Promotora model, working closely with the school and trying to meet their needs, as well as partnering with UCI and working in an academic model and teaching new healthcare professionals as they come through. Sure. The partnership between the Peace Center and Share Our Selves, simply put, just makes sense. I think that the two organizations really have similar visions and mission statements, and you know, the Peace Center was the idea of the Saddleback Church to minister to people in need through by giving them food, financial, and spiritual assistance. And you know, SOS is the medical clinic within that greater vision. So we're the vehicle by which the Peace Center can deliver those clinical services to people in need.
It's been fantastic. Our schedules are full. We are even thinking maybe we might need a second provider over here, even though we're just a 20-hour clinic, because the need is so great. One of the things we do is we serve MSI here, and about 72% of our patients come through that referral source. And in South County, there are only 3 places where you can actually utilize your MSI insurance. And one of them is currently capped and one is not accepting people. So now it's down to the Laguna Beach Community Clinic and us. So if we didn't have this partnership, these people would literally have no access to care. They could get the insurance, but then they wouldn't be able to go to the doctors.
I think there's an unmet and an overlooked need in South County. People have a perception of South County different than they may from northern or central Orange County, and but there's absolutely a need down here, and I think the general response from the community has just been gratefulness that we're offering the same type of services that we've offered in Costa Mesa for a long time.
be part of SOS. I've helped SOS for a whole year, and I've learned a lot through them, and I think that now that I'm part of it, I feel that I'm going to be able to make more connections and help out a lot more people than what I was doing before prior as just a helper, and now I'm actually the person to be put in that situation to say, okay, you can make those decisions and help those families when they come to you.
To me, it means like I'm making a difference for the community being at El Sol and SOS. Also, we have more of contact with just the community here because of the parents and the kids that come to El Sol. I feel like I'm making a difference with each patient and following up with them, and I see it as I'm making a benefit for the whole family, not just the patient that's coming in.
On a personal level, I feel really blessed, and I've always felt blessed to be a part of SOS because while it's been a place for me to grow professionally and to do what I'm able to do as a practicing medical professional, it's also just close to my heart. I mean, the ability to see real change in people's lives on a daily basis, you can't really put a price tag on that. And so in particular with the Peace Center, it's been extremely exciting to be able to kind of have been homegrown at SOS since 2005 when I started as a PA, and to be able to start building that again from the ground up in a new location. And it's been a really exciting time.
SOS stands for Share Our Selves. So one of the things that I'd like people to think about is share. Everyone that walks in this door to work every day is giving something of themselves. They could be anywhere else they could be. They could be working in another facility, but they choose to be here at SOS. So they give of themselves to better our patients, to better our clients. From the security guard outside, to the providers, even to the volunteer staff that come in on a daily basis. So to be able to give some piece of you to make someone's life better, be it from the medical standpoint, from the social standpoint, from the mental standpoint, we truly give something unique to every person that walks in through this door. That's what makes SOS to me so unique, and this is why I'm here.
We Are SOS means I share with you and you share with me, and together we do all the things that need to be done to assure that our children, our grandchildren, will live in a wonderful community. That's what it means.